I purchased a light walker because I was at an American Academy of Periodontology meeting, and I ran into a few of my former instructors from training as a periodontist. And they had just started with the PerioLase, and they were very happy with the results they were getting. And they're speaking to me and they were saying, you know, you really need to try this. So when I was at the meeting, I went around and I looked at the different lasers that were available. The light walker was probably about half the cost of the PerioLase, and it also included an erbium laser with it, which I could do other things with. So the people at Photona pretty much said, yeah, a lot of these lasers originated from the same place. They're constructed pretty much all the same way. They do the same thing. We're using the same wavelengths and what have you, and said you can do the same thing with this laser as you can with the PerioLase, but you know, it's going to be much less expensive, and you also get a second laser with it, the erbium laser. In retrospect, if I had to do this all over again, I would start with the PerioLase. Part of the problem was with the training of it. And I went to their 3-day training course, but much of it was not directed specifically towards periodontal treatment with it. The amount of training directed towards the actual periodontal therapy part of it, using the Nd:YAG laser or even the erbium YAG laser with it, was not as much as I felt I needed. So after training, when I got back to my office, I wasn't really confident to use it. I almost kind of put it aside for a while, and I had said to myself, why did I get this? And I kind of had to go back pretty much and try to retrain myself. The training for the LANAP protocol is pretty much, except for some side things, what is the main emphasis on this training, so that we're not running into having to prepare teeth or try to do endodontic therapy with it. I'm getting exactly what I want as a periodontist, and you know, they're showing me how to treat the periodontitis and the periimplantitis with it. As a periodontist, my advice is to those individuals that would like to purchase a light walker, I don't think it's going to go ahead and give you the satisfaction that the PerioLase is going to give you. I don't think you'll be as satisfied with the training that you get. I don't think you would be as satisfied with maybe the operation of the unit itself. I see a difference in the way this one fires. It's more consistent. Sometimes I wasn't sure whether I was getting the right power levels with the light walker. With the PerioLase, they have a power meter built into the unit. So you can go ahead and test your unit, make sure you're exactly where you need to be before you start using that on your patient. Fairly confident with the documentation and the literature that I have reviewed that I will get better results, especially after the training I've gotten the past couple of days.